Now let's get into our impression techniques. The first technique we want to talk about is our triple tray impression technique. And we use this technique because we want to have a supported tray. We want to make sure that it's rigid. It also has side walls that provide us really good support for the impression materials. We also want to make sure that we're utilizing enough impression materials, and we're going to talk about that because a lot of times bad impressions come from us not utilizing enough material. And making sure that we look over our impressions. If it's something that we're doing a preoperative for, we want to make sure we look it over because there will be times that maybe we didn't take a really good impression for our provisional, and then our provisional does not fabricate as well or look as good, and we may have to add a lot of material to the provisional based upon the type, based upon the reason really that we didn't take a really good preoperative impression. We also want to make sure that we're seating those impressions trays properly, and we're going to show you that here in our video, because of the fact that we want to make sure that that proper tray placement really is going to capture the posterior tooth or the last tooth in the mouth, which is really important in making sure that the tray is able to be seated correctly so the patient can bite down correctly into the material. And this is something that, again, we're going to talk about, but we also want to make sure that the patient understands. And so we always want to try that tray in, make sure that we try it in and that the patient knows they're going to be biting down hard, biting down all the way into that material. So you really want to make sure that you understand all of these areas before we begin to take our triple tray impressions. So the first impression we're going to take is how to load our triple tray impression. And so we're going to just demonstrate the technique utilizing a machine to load the material into the triple tray. So I've got my triple tray, and the first thing that I want to make sure too is the fact that I know exactly where I'm going to be taking my impressions, and we're always going to line up the back of that triple tray and try it in. Don't just assume the patient's going to know exactly where to bite down on, because some patients will bite and they'll actually hit the plastic, right? So if they're hitting the plastic, you know that those teeth are not going to be engaged all the way and the patient's not going to be able to bite down. Hence the purpose for the mesh. And so I'm always going to kind of give the patient an idea of exactly what we're going to be doing today. We're going to be taking an impression before we start the procedure, and I want to just kind of seat this and tell you a little bit about how this is going to feel and make sure that you can bite down all the way. So I'll place it in the patient's mouth, and I'm going to ask Mary to close for me and make sure that I have a really firm grip on that, okay? So that is always important, and making sure that they're not hitting that plastic. Now what I'm going to do is I'm always going to utilize a timer, because in dentistry everything is slow. The beauty of the Vipicil is the fact that we can have a really fast setting time and a working time, so I still want to have a timer. So what I'm going to do is I'm going to go ahead and just start extruding some of the material out, okay? And I'm always going to start the furthest away, and I want to make sure that I have enough material and I'm not lifting my tip. You can see that I'm going to make sure that nothing is lifted until I get to the very end of that mesh, okay? Now what I'm going to do is flip it over, and I'm going to start again. And I got to move pretty quickly, because remember, this is a fast setting material, okay? And I'm going to sit that down, all right, making sure I've got enough product on both sides. I'm going to take the tray and I'm going to insert it in the patient's mouth, just like that. And I'm going to ask Mary to close down on it all the way to those teeth are engaged. Now I'm going to demonstrate how to take a triple tray impression utilizing a cartridge material.